right. This is going to be a kind of quick overview of the mood disorders, in particular the depressive disorders. And what I'm really trying to do here is help you understand the difference between a disorder and an episode, and to some degree also the schematic that exists between the ICD and the DSM. Now, these are the disorders that are in the two. The DSM has mood episode, major depressive, recurrent, brief, disruptive mood dysregulation, which is an interesting disorder. It's really ODD, but shoveled over here, and persistent mood depressive disorder, which is also known as dysthymia. The ICD is a little simpler. It's basically manic, bipolar episodes, depressive episode, recurrent depression, depressive disorder, persistent mood, cyclothymia, and dysthymia. Now, there is pretty significant speculation that the split of bipolar in the DSM was really governed about the different medications used to treat bipolar and unipolar depression, SSRIs, versus the lithium and lithium-based type medications. So bipolar is a separate category, and I'll be dealing with that next, but it basically includes these disorders, and it's not part of the mood disorder, depressive mood disorders as a single category anymore. Instead, the DSM uses disruptive mood dysregulation. As I said, this kind of deals with adolescent irritability, agitation as a presenting problem. It also looks at single episodes and recurrent episodes. And persistent mood depressive disorder, which includes dysthymia or is in fact dysthymia, seasonal patterns, premenstrual, and medical conditions. I don't teach the last two because those are medical conditions. Premenstrual is really a gynecological problem, and medical conditions is a medical condition. Episodes are clinical or subclinical levels that cause impairment. And in essence, episodes are building blocks towards a pattern of disordered mood, single, cycle, recurrent, or durations, that is, where the person has the symptoms long enough to meet criteria for a given diagnosis. So you're going to be looking for duration and pattern. Episode is a valid diagnostic criteria. It's just not billable. Now, in the DSM, much like the ICD, the specifiers are really mild, moderate, or severe in terms of severity, whether it's in full or partial remission, and people do go into remission, with or without mood congruent psychotic features, or other features include anxious, distress, mixed features, melancholic, which you're going to see with Barbara, catatonic, which you see in Mary Ann in her depressive cycle, typical, seasonal, and postpartum. Again, I don't deal with postpartum for the obvious reason. It's important to consider longitudinal courses. Longitudinal courses are not only whether somebody's been depressed for 1 week if they're a kid, or 2 weeks as an adult, or whether they've been long enough depressed as a bipolar to meet criteria before the cycle switches. But it also includes longitudinal whether there's a seasonal pattern or other patterns such as anniversary-based or postpartum-based. And secondly, you want to look beside longitudinal whether there's a cyclical pattern. In bipolar, even if the depression looks exactly like what you expect for a bipolar depression, unless you have a hypomania or a full mania, you can't diagnose the bipolar. You need the full cycle in that disorder in order to make the diagnosis. Cycling also includes a seasonal affective disorder. If somebody gets real depressed in October, and they remain depressed until April, until you've seen the pattern a second year, or they can report an year earlier pattern around the same time of year, you haven't really established seasonal affective disorder because you don't know whether it's a single episode that just happened to last during that period of time. Anyway, no matter how you look at it, you need an episode to make a diagnosis. And as I said, some are duration based and some are pattern based. And with the pattern and durations, you want to think very carefully how they're presenting and get good history. Think of Ashraf, where the pattern was that he had highs and lows, but they diagnosed narcissism. Now, the same ICD-10 definitions exist. They're pretty much a reflection of each other. Hypomania, with or without psychosis, bipolar affective disorder, which is what they call bipolar 2, depressive episodes, mild, moderate, severe, with or without psychotic symptoms, other depressive episodes, atypical depression, and depressive episode unspecified. Recurrent depressive disorder is an interesting one. Most people, particularly between the ages of 25 and 49, tend to have more than one depressive disorder. The intensity and duration of those is one of the things that is, in terms of getting a good history, you want to get a sense for. And so you not only want to know what the current episode is, but you also want to know what the chronic history presentation is and whether or not it ever included a psychotic element to it. And in recurrent depressive disorder, you might want to consider when somebody has a pattern where every month at a particular time they crash and have a severe depression, but they never have a hypomania and they never meet duration. Again, you want to talk about the periods of remission. Other recurrent depressive disorders include unspecified, my favorite. So in the DSM 5, they exclude the criteria for bipolar, cyclothymia, and it is included in the ICD. And they also include dysthymia recurrent and other specified. And that is pretty much what we have in the introduction. And I'll be fleshing this stuff out more when we look at a unipolar, that is the full depressive disorders, and bipolar.